Well, 7 is the number of people who are currently infected by the coronavirus in the country. This latest development coming at a time when the government has sent a stern warning to traders who might hike prices of commodities to take advantage of the situation that Kenyans are currently in and make super profits. It is the 18th day of March 2020. Welcome to Ebru Prime Time News. My name is Munene. Our sign language interpreter at the bottom end of your screen is Joyce Waremo. But also ahead on this bulletin. Good evening and welcome once more to the program. 3 more cases of coronavirus were today announced or confirmed in Kenya, bringing the total number of confirmed in Kenya to be 7. The health CS, that is Mutahi Kagwe, said that all cases are from people who had flown into the country from abroad. Have a look.
2 of the new cases are a couple that had traveled from Madrid, Spain on March 4th through Dubai and arrived in the country on March 5th. The 3rd case was a Burundian national who traveled from Dubai to Kenya, arriving on March 17th. The patient recorded high temperatures during the routine screening at the Jomo Kenyatta International Airport in Nairobi.
Following tests that were carried out by the National Influenza Center as well as Kemri laboratories. Therefore, we now have in the country 7 confirmed cases. It is very, very important to note that all these cases have been imported cases from outside the country.
Mutahi also added that the tracing of the individuals who are in contact with the patients is ongoing.
It is an offense punishable by a jail term for you to say that you are going to self-quarantine and you do not. And effective today, any Kenyan who is traveling from outside the country must sign a legal form at the airport that they are going to self-quarantine themselves, which gives us the instrument to actually jail you.
Currently, 18 people are admitted at Mbagathi Isolation Center. 7 others have been screened and are negative. Samples of the remaining 11 suspected cases are currently being tested.
If you don't even have a temperature and you are not showing any sign of anything, then why would I test? I haven't tested because I haven't developed any symptom. But if I did, I would want to test. And when they test, then it is not chargeable.
Mutahi says the 7 who tested negative will be discharged to continue with self-quarantine at home and with close supervision of the Ministry of Health staff, collaboration with the country's surveillance teams.
It is now clear that the threat that we face, first and foremost, is the threat from Kenyans who are coming from overseas or Kenyans who have visited overseas countries. And that is why we had said that Kenyans who are coming in must self-quarantine.
Elsewhere, the government is looking for 85 people who came into contact with a woman who was discharged from Mbagathi Hospital after testing negative for coronavirus and returned to the facility 24 hours after she developed symptoms.
And through the security apparatus in the country, we were able to trace the patient wherever she was, and we brought her back into Mbagathi and tested. Of course, it was positive, and we have traced the contacts of this particular patient. As at now, we are following 85 contacts actively, and we'll be giving you updates on the outcome of the contacts that we are following.
The 23-year-old was readmitted to the hospital on Tuesday afternoon at a time when Kenya confirmed its 4th coronavirus case. The woman claimed that since she was discharged from hospital, there was no follow-up on her conditions by health officials. However, she claims she returned to the hospital on her own volition using public means. There are, however, conflicting reports that she escaped from a surveillance ward. Across the world, the virus has claimed more than 7,500 people, with Europe being the new epicenter. Italy remains the worst hit due to fatalities and positive cases. Busara Naman for Ebru TV.
Now, the All Saints Cathedral has asked couples that had planned weddings for the next 4 weeks to consider cancelling the plans. In the extreme circumstances that a wedding cannot be cancelled, the cathedral has advised couples to consider a 30-minute ceremony within the church precincts. Now, the half-an-hour ceremony will not have more than 10 people. Attendees will be under the strict guidance of the cathedral's provost. Additionally, parties who have travelled in the recent past will be required to have self-isolated or sought medical attention before the wedding. This comes even as CITAM Church has suspended all services and prayers.
CITAM will therefore suspend all Sunday and midweek services in all our sanctuaries across the nation for the next 3 Sundays, after which we shall advise on the way forward, having reviewed where we are as a nation. We'll conduct weddings and funerals as per government guidelines during this period, and will also follow same guidelines given regarding hospital and home visitation.
Now, the Nairobi Central Business District and its environs will tonight be fumigated as part of the measures to contain the spread of coronavirus. Street families will be disinfected during the exercise.
On Tuesday, County Deputy Director of Health Wilson Langat said fumigators will be mounted on county vehicles in the CBD. The vehicles will move around and disinfect locations within the CBD. The Ministry of Health is expected to provide the necessary equipment for the process.
At the possibility of ensuring that all our choke points, and choke point here we're talking about bus terminals, where all of us meet when we want to go home in the evening or coming to work in the morning, that at night, during those we can call, the silent hours, that we can have them being sprayed and fumigated, so that when we come in the morning to work or to other places, they are fumigated, and again it goes on in the evening. But it requires a participation from all of us. I did mention about keeping water in public places so that we can be able to wash our hands. But it also calls for responsibility among us ourselves.
Street children being part of the Nairobi County community, county government is planning to sanitize those who will be found on the streets. The first fumigation in the country was done on Saturday in Rongai by public health officials after it was reported that a woman who tested positive for coronavirus resided in the area. The 27-year-old woman landed in the country on March 5th from the United States of America via London. Countries which are using fumigation against COVID-19 include India, China, United Kingdom, Australia, and Iran. The Nairobi government will start training at least 3,500 health workers on coronavirus by Friday.
We'll not end there. We're also going to the community level to be able to provide them, one-on-one training, one-on-one engagement with them. We are aware that social gatherings have also been suspended, and therefore we're going to break into small teams as we go down to the community level so that we can be able to engage in community training.
County's health executive Hitan Majevdia confirmed on Monday that 80 health officers were trained at Mbagathi, 112 in Mamalusi, 60 in Pumwani Maternity, and 38 at Mutuini hospitals. On Tuesday, 100 health workers underwent training on coronavirus, 50 at the STC clinic and 50 at Pumwani Maternity Hospital. He noted that by Wednesday, which is today, it is expected that the training will escalate, aiming at 3,000 health workers across Nairobi. The county administration urged city residents to access services online where necessary to avoid crowding at City Hall and take the basic and simple preventative measures on sanitation and avoid crowded places where necessary.
Now, only 2 laboratories in the country are currently able to test for the coronavirus, a concern that the Council of Governors has raised. Governors now want the government to decentralize diagnostic laboratory services, which are currently being conducted by KEMRI and the National Influenza Laboratory. Here's Diana Rachel Mbogwa with more details on that.
Contrary to the national government's reports that Kenya has the capacity to test for the virus across the country with different KEMRI and national influenza laboratory centers set up, governors are lamenting lack of more centers in the counties, which has minimized preparedness of fighting the spread of coronavirus. The county bosses feel that the government has restricted their measure to fight the spread of the virus by centralizing diagnostic laboratory services.
We're asking the national government to decentralize the testing because one of the biggest problems we have seen across the world is that unless we are able to test many people as we can, we will not manage this virus.
Tuko na lab, tuko na all the equipment ready ya kutest coronavirus. Tunangojea tu tukue accredited, tukue approved. And it is the same with other counties. Tuko tayari, we can start testing coronavirus tomorrow. Tunataka ingine ikue western, ingine ikue north, south. We cannot bring everything to Nairobi.
We got 4 residents who have been staying overseas, 3 in UK, and 1 in Holland or Netherlands. If it was not because of the alertness of the people in the villages, they would have gone there and invited people all over the place. But we were able to contain the 4 very fast. Unfortunately, we were not able to test them because the testing is centralized.
Led by Chair of Council of Governors Wycliffe Oparanya, the county chiefs further challenged the national government in the distribution of the testing kits to the counties, noting that they have received less than the government had promised.
The kits which were distributed, I think they are short in terms of the booths. Instead of 25 booths, we only got 5. It's critical we get the remaining 20 so that our health personnel can do the work they are doing.
However, the government in response says there is a global shortage of the kits.
We have already sent to each county the initial kits that were crucial for any emergency. We sent 25 kits to every county, each county. And from tomorrow, we are now going to be dispatching everything else in accordance with the requests of the counties.
The governors have further called for the national government to allocate funds to counties to deal with the current pandemic as an emergency fund for dealing with the coronavirus.
At least 2% of our budget we set aside for emergency. And I've clearly said, as we approach the end of the financial year, those accounts or that vote, you'll find that it is stipulated.
Now, this is an enemy that does not know any borders of any country or any county. That is why we need to work together with all our counties to ensure that we are able to confront this disease.
The governors are also alarmed at the impact the coronavirus pandemic will have on the economy, with businesses and factories already letting people go. They now want the president to meet with involved stakeholders to plan a post-corona solution.
Ingine tuweke pesa kando that we can cushion. Kuna biashara zinafungwa, kuna hoteli zinafungwa, kuna factories zinafungwa. How are those factories, how are they going to continue after this pandemic? Zingine zitafifia kabisa, watu watapoteza kazi.
Even us, those who are landlords like you must also sacrifice and say, this 1 month, my tenants will not pay rent as we go through this crisis, so that everybody is contributing to this crisis.
With at least 7 cases of coronavirus confirmed here in the country, the Council of Governors has now called upon the public, especially the elderly, to restrict their movements, especially using the public service vehicles, to minimize spreading of the virus. Diana Rachel Mbugwa, Ebru TV.
Now, Nairobi City County has a new sheriff in town following the takeover of key services by the national government. The takeover became effective after President Uhuru Kenyatta created the Office of the Nairobi Metropolitan Services, which will be headed by Major General Mohammed Abdallah Badi.
It's now official. The national government has taken charge of the capital. President Uhuru Kenyatta has created the Office of Nairobi Metropolitan Services, which will be headed by Major General Mohammed Abdallah Badi, who will be deputized by Enosh Onyango Momanyi.
So therefore, ladies and gentlemen, after today's signing ceremony, I have also today created the Office of the Nairobi Metropolitan Services. This office will be headed by Major General Mohammed Abdallah Badi, who is here present, who will take over as the Director General of the Office of Nairobi Metropolitan Services.
The two have been asked by President Uhuru Kenyatta to lead in bringing to end corruption.
Complaints of corruption and having to pay out bribes to receive permits and approvals must and will be a thing of the past. Therefore, it is critical that we take practical steps to rid this section of corruption, ease the pressure on construction sector, and reduce the cost of doing business.
NMS will take charge of a crucial county functions that were handed over by the county government.
The Nairobi Metropolitan Services, or as it shall be referred to, the NMS, will be in charge of the functions that are transferred to the national government on behalf of the national government. Their primary responsibility would be to ensure that they deliver the services to the citizens of Nairobi.
This comes even as the Kenya County Government Workers Union have poured cold water on the national government's move of collecting Nairobi County government's revenue. The union, led by their Secretary General Obaduba, said they will not comply with KRA demand to submit county documents to the authority.
Ama ya county ya Nairobi, enda kwa mwajiri yao, mwambie tuna hii kazi ya kufanywa, tunaweza pata watu hapa. That communication we can only take from the employer because that is the law. That is the practice. Yes. That is the custom and tradition of civilized society. Yes. Otherwise rejected. Yes. Now kuna mfanyakazi atakanyanga kwa KRA.
The deal saw the handing over important dockets of health, transport and public works. The decision by the national government to take over was timely as Nairobi was facing political chaos both from the executive, which led to the paralysis of services. Sonko, who is facing graft charges, was barred by the courts from accessing his office at City Hall. He also lacks a substantive deputy and was saved by President Uhuru Kenyatta from impeachment by the MCAs. Abdes Hashim, Ebru TV.
Well, moving on, Kisumu County is on high alert tonight after a patient with coronavirus symptoms was quarantined at the Aga Khan Hospital in Kisumu awaiting test results. The devolved units are now in the situation where nothing is off the table when it comes to combating the spread of COVID-19.
The number of confirmed coronavirus cases in the country is feared to rise as Kisumu Governor Anyang' Nyong'o confirmed that the patient, who is a Briton, is being quarantined at the Aga Khan Hospital in Kisumu after he showed symptoms of coronavirus, awaiting test results. The governor has since come up with a raft of radical measures aimed at combating the spread of COVID-19 in the county. In Nakuru County,
in a likely event that we leave this unattended, we are going to have a disaster.
Former Naivasha MP John Mutudho is calling on the Lee Kinyanjui government to crack down on commercial sex workers as one of the measures to contain the spread of coronavirus.
That since these people are known, they are called through their leadership, and each person gets at least 1,000 or 2,000 shillings. Go home, sit home for 6 weeks, plus maybe 2 debes of unga or maize, and about a dembe of beans.
In Meru,
I want to confirm that coronavirus is real.
The governor is also not leaving anything to chance, banning activities in a bid to reduce crowd contact.
We have suspended all market days in Meru County for the next 30 days. All nightclubs, discos, and the other recreational facilities, including public parks like Intera Park and all stadiums, will remain closed to the public for the next 30 days.
While also threatening punitive measures to traders who will take advantage of the situation.
And especially not to hold goods or right prices as a result of the situation in which we find ourselves. Anyone engaging in these malpractices will have their license revoked.
Isiolo County is not left behind.
Ikifika saa 12 wewe chukua mira yako na uingie manyumbani kwako.
With Governor Kuti asking residents to take precaution even on hobbies.
Na hiyo miraa uoshe na maji moto. Tafadhali usikule miraa. Unajua hiyo miraa, najua wengine wanasema haitaleta andas, lakini hiyo miraa kumbuka ilikatwa na mkono ya mtu, ikafungwa kwa bundle na mkono ya mtu.
And if you are a mall owner in Machakos County, then you must stock hand sanitizers, failure to which the Alfred Mutua-led administration will come for you.
Na ile shopping mall ambayo haita supply sanitizers ama mahali ya kuoga watu wakiingia na watu wakitoka, we will shut it down.
In Eldoret,
najua sisi corona hapa haitatupata.
Traders have teamed up to boost efforts by the county government and are taking measures to ensure their safety from COVID-19.
Sasa wewe sio msafi, hii soko haiwezi kukubali. Kama unakataa kuoga hawakuuzi.
Tumechanga kila mtu kitu kidogo kidogo, alafu tunanunua hiyo mitungi na sabuni. Kila wakati tutakuwa tukinunua, ikiisha tunanunua.
From that country up now, and just a day after Likoni ferry commuters decried of the unpreparedness of the county government in fighting the coronavirus, the Kenya Ferry Services has swung into action and quickly erected 100 washing points. Sensitization on the measures placed by the Ministry of Health will also be provided to the residents while using the channel.
Following the uncertainty of the safety of the over 300,000 Likoni ferry commuters at the Likoni Channel, the process of fumigating the vessels has already begun and will take place each day as a basic measure. KFS Managing Director Bakari Goa, while addressing on their preparedness, has called upon the commuters to effectively use the 100 hand washing points erected to counter any eventuality of the coronavirus spread.
We are giving that an average of around half a minute per person. So within 5 minutes, we expect to serve 1,000 people. And this is good enough for us to ensure that we don't have long queues.
On the issue of the crowd control, Mombasa County Commissioner Gilbert Kitio said they will encompass the county marshals and NYS to ensure the congestion of the residents is looked into.
We have done our best to try and decongest some sections of Mombasa, especially the public areas like public beaches and places like Mama Ngina Drive. We have also stopped the nightclubs in various places, and we have encouraged people to provide hand washing facilities within the markets and of course the bus stages. Some of them have fully complied, but there are a few whom we are still pursuing to try and comply.
So far, the government has tested 111 cases since the pandemic was first confirmed, with 4 individuals testing positive for the virus.
Allies of Deputy President William Ruto now say the coronavirus pandemic in the country is similar to the political wars facing the DP, William Ruto. So MP Caleb Kositanyi now says it is only prayers that can sanitize the country from not only the coronavirus pandemic, but also the political clamor.
The COVID-19 pandemic in the country has started running down the steep political hill, with allies of Deputy President William Ruto now saying the pandemic is akin to the political wars facing the country's number 2.
We shall overcome corona. We shall overcome reggae.
The Soi Member of Parliament, who is an ally of Deputy President William Ruto, now saying that the country is in a deep spiritual war, seemingly over the rift between the president and his deputy, brought about by the BBI.
Hii mambo yote ambayo tunapitia kama Jamhuri ya Kenya, we are not fighting a political war. We are fighting a spiritual war.
There has been questions after the Deputy President was conspicuously absent from key public events, including critical meetings to address the coronavirus pandemic. He was absent on Sunday when his boss announced 2 more cases of coronavirus in the country. This was moments after he was spotted attending a church service in Langata. A week earlier, on March 13th, the Deputy President William Ruto was absent at the National Security Council meeting that was chaired by President Kenyatta, something that raised eyebrows since he had also skipped a brief on the National Emergency Response Committee on Coronavirus that was held a day earlier, on March 12th. In the recent past, reports of the so-called system emerged with the Deputy President's allies alleging that the government was working to isolate the DP.
We shall overcome all evil that is being planned against one other person if we all turn to the Lord and pray.
With Kositani now saying that prayer is the ultimate sanitizer.
I want to urge all Christians, wherever you are, irrespective of what denomination, pray for the nation of Kenya.
Now moving on, Nakuru Governor Lee Kinyanjui has urged retired military officers and people trained in disaster management to register for training on control of the novel coronavirus in order to volunteer their services in the campaign against the disease. The governor says the county government of Nakuru has rolled out deliberate training programs for various stakeholders in the county in efforts to expand the pool of responders to potential cases of the coronavirus.
The county of more than 2 million people is at risk to infection owing to its numerous tourism and commercial focal points, according to Governor Lee Kinyanjui.
The county government of Nakuru will enlist services of trained personnel who may wish to volunteer their services to the county. In this respect, we shall conduct training and preparedness drills to such members. And here we have former members of Red Cross, St. John's Ambulance, retired medical personnel, maybe military personnel, and anybody who thinks that they have a role to play. So in the event there was an escalation of this, we'll have a list of such persons and we would wish to train them.
The county government says that participants drawn from various disciplines will be equipped with skills set to help more than 40 specialists to avert transmission and respond to reported emergencies efficiently.
It is in our best interest to ensure that we don't just hope for things, we also prepare for any eventuality that might come. As an example, our provincial general hospital here, sometimes we have as many as 1,500 visitors in a day. And we consider this a high-risk exposure. Consequently, we wish to discourage visiting to our patients to bare minimum.
The governor appealed to Nakuru residents to adopt retail deliveries, exercise social distancing, and avoid mass hospital visits at the county health facilities and other large social gathering to minimize infection of the dreaded disease.
The reality is that we may not have provision of water services to everybody. So even as you say that wash your hands as many times as you want, wash with sanitizer and all that, they may not be available. And therefore, as a county, we wish to supplement the water supply to the slum areas, and we will work together with our administrators and provincial administration to provide tanks and washing points at all vantage points within our slum areas. And this is in line with the advice that they should wash their hands as often as possible.
The move comes amid voices of discontent among dwellers in the area, where water is heavily rationed and most people resort to using unsafe water or simply stay for days without water, making proper sanitation problem. The county boss said the health services in Nakuru is currently testing foreigners coming to the county as tourists and expatriates to curb new infections.
It's 30 minutes past the hour. We hope you are enjoying this bulletin. 40920 is our SMS line. Tell us what you think about this broadcast as well as our general programming. Don't go away. We still have a story of resilience, a man who's taking care of those who are not so loved in the society. Keep it here. Well, thank you for staying with us. You're watching Ebru Prime Time News. Now, local hospitals will be forced to deny some patients ICU beds should the COVID-19 infection spike. Announcing the 3 new cases earlier today, Health CS Mutahi Kagwe said it is time that Kenyans started taking the virus with the seriousness it deserves, terming it as a threat to the country and the economy. Here's our reporter Winnie Lubembe with more.
Fears about ICU bed rationing comes from the disease trajectory in China, the US and Italy, which are already controlling occupancy of such beds. According to the World Health Organization, many countries with confirmed cases report a sharp spike before the curve comes down, China serving as an example. However, countries can flatten the curve by preventing and delaying the spread of the virus so that large portions of the population are not sick at the same time. Kenya confirmed its first case of coronavirus last Friday on 12th March, with President Uhuru Kenyatta confirming 2 more cases on Sunday. However, more cases were reported on Tuesday and Wednesday, resulting to 7 in total.
We also want to appeal to the general public that if you know that an individual who has agreed to self-quarantine and you can see them not self-quarantining, please report them to our toll-free number, 719, and let me remind such people that it is an offense punishable by a jail term for you to say that you are going to self-quarantine and you do not. And effective today, any Kenyan who is traveling from outside the country must sign a legal form at the airport.
So far, laboratories at the Kenya Medical Research Institute and the National Influenza Center have tested over 100 cases since the COVID-19 pandemic struck the country. Of the countries affected by the COVID-19, Italy has been forced to ration ICU beds for critically ill patients. The country, which is currently on lockdown, has over 31,000 confirmed cases with over 2,500 deaths. Globally, over 8,000 people have succumbed to the illness and over 200,000 others have been infected. Winnie Lubembe for Ebru TV.
Now, sometimes society is not welcoming to people with physical or psychological problems, but for Timothy Mbugua, he has beaten all the odds associated with stigma against the mentally challenged persons by showing them love and care. Kaindo Stefano had talks with Timothy Mbugua and the team that he leads, and this is the story he prepared.
Wangige Market in Kabete, Kiambu County is a market full of activities. Traders doing what they do best. Everything looks normal, but there is an issue within this market: the presence of mentally challenged persons. In the farthest end of the market is a rectangular tin-thatched shanty fully decorated with beauty accessories. This shanty belongs to Timothy Mbugua, also known as Muthiomori. It acts as his business place and also a place where he grooms, feeds, and also counsels the mentally challenged persons. Taking care of the mentally challenged is Mbugua's calling, because he himself got helped when he needed it so much. Mbugua was a medical student in Russia, and his ambitions came tumbling down when he got ill. Mbugua was mentally challenged for years, came back home and got help.
Is that okay?
We visit Mbugua at his workplace, and he's attending to David Njuguna, a mentally challenged man from Wangige. David has been ill for many years, and Timothy Mbugua and Dr. Cosma Kaburu Mutundu intervened. Although David's looks don't reveal much, he was born in 1963.
I'm about to go away.
You're about to go away?
Yes.
Okay.
Older for.
Your education?
Just from 4.
From 4?
Yes.
I've been doing this since 2010. Yeah. Since 2010 I've been doing that, and he's not alone. We have over 100 people here that we take care of.
Even though David's situation is improving, his uncle Peter Karanja is a worried man.
Mimi nasikianga baya sana kwa maana alikuwa mtoto mzuri, alikuwa amesoma, alikuwa anasoma na dada yangu kabisa. Akaenda Kilangali High School, akafanya form 4, akapita. Kabla hajapata mahali popote, nilimchukua kama uncle yake, nikaenda naye Kahawa. Alikuwa anatakiwa kwenda college ya walimu. Maisha yake ikaharibikia hapo. Na hata wakati namuonanga hapa, nasikianga vibaya sana.
It's not Njuguna alone who is under Mbugua's care. Meet Brian Chege. Chege was born healthy and kicking, but a car accident at the age of 9 brought about challenges in his life. Since then, Chege has been battling mental illness. Chege has a vision to work and improve his life.
Nilisoma kuanzia primary, nikafanya KCPE. Sasa nikamaliza shule. Sasa nilimaliza shule, sikupata shule. Nilisinda nikikaa nyumbani.
Just like any other child, Chege's mom means a lot to him. He takes his mom's advice seriously.
Kuna kitu nataka kusoma. Sasa kama hiyo mamangu, mimi naamini mamangu. Sasa siwezi kataa. Vile mamangu anasema, nakubali.
Monica Wanjiro is Brian's confidant, and she monitors his move and guides his aspirations.
So, tunafuatilia kwa shule. Ndio tuone wamemkubalia venye yako. Ameenda, tukamwambia ni vizuri afanye dressmaking. Kwa sababu yeye mwenyewe alikuwa amejichagulia fanya catering. Na ile shida yako nayo, anaweza akaanguka kwa moto.
Meet Sarah Wangoi. His two sons are mentally challenged. Christopher Nganga and David Washaga got help from Timothy Mbogwa when they were in a bad state of health, and they were taken to Madari Hospital in Nairobi County.
Ameanza kutoka standard 3 na miaka 10 kama imegojwa. Leo kwanza anapelekwa huyo Christopher, anapelekwa hapa rehab. Kama anatoka amerudi tena namna hiyo, alafu anapelekwa huko.
Sarah hurts a lot from negative village talk about her children.
Si unajua watu ni watu. Sijui watu wanasema ni mzuri au mbaya, but watu wengine unajua ni baya. Kwa sababu watu wengine maana huyo Wasaga manampea petrol akunywe. Kama na maona manasema ati niende polisi. Sasa mimi naenda polisi. Namuuliza kama ni mtoto yako umfanya namna hiyo ni mzuri. Manasema enda polisi. Sasa nitang'ana hakuna nguvu ya kumeng'ana bado tembelea bati tutaenda Sunday kuangalia.
And when Sunday came, she made her promise real, visiting her sons who were doing great after being placed under medication. Meet Charles Masharia Thairo, who is doing great health-wise after years and years of battling mental illness. Timothy Mbogwa and Dr. Kaburu intervened and placed him under care.
Niko sawa. Niko mgonjwa lakini nimepona. Ndio.
Charles Masharia is a happy and a thankful man since his recovery, and he has some advice to those who hide mentally challenged persons.
Mama umirie. Mone kwa kuteithikira. To mundu aithoti wega. Igimera meige umwirigiro hari mwathani mundu ni ahonaga. Ira matigakue ngoro.
Timothy Mbogwa is a household name, and his initiative is well known by many, and this is affirmed by Nyumba Kumi chairman James Mungai Kangunjo.
Long since Masharia has been sick, and Masharia is known here. In fact, it looks different now. He has had a problem with schizophrenia.
So the work is difficult because some parents are so abusive to their parents or to Mr. Mbogwa, or whenever he comes to rehabilitate the kids. But also they cannot talk to anybody else except Mbogwa. I don't know what he tempts them with. He has done a lot of work. He has come from far. Hapa alikuwa na arara huko nje. Na wakati alirecover through people helping him. Alikuwa hii watu wa beba, kwa kama watu wa marikito na beba mizigo. Lakini sasa the way he is, he don't want others to suffer like he has suffered. That's why he has fronted day and night to see these people have recovered. We appreciate about his work.
We head south of the market. This side of the market is busy. Second-hand clothes and other garments are on sale. In between the iron-thatched structures is a little hiding place, which is home to Abdul. Abdul has a mental illness. Timothy and Dr. Kaburu check on him now and then.
Iko mzuri? Abdul? Iko mzuri? Wewe ni Abdul ama ni wacha kuuliza. Wewe ni Abdul ama ni Zakaria? Abdul. Oh. Zakaria ni nani?
Maybe to be treated free. Who can do it? There is no background. You understand? No so no identity card, no what. So we help what we can. For example, in this case, we make sure that he's clean. We make sure that he's eating. We make sure that when he has something, he had medications.
We head down to the core of Muthomo village and reach at Paul's residence, a wooden house down the hill. Paul comes out and he looks unkempt. He is in a lot of pain. Paul was mentally ill, and his ups and downs during his illness might have caused him an injury that infected his leg. Now Timothy Mbogwa and Dr. Kaburu are working so hard to prepare him mentally because medics say his leg should be amputated.
Mugu iko na shida. Iko na 10 years ago.
And we make sure that every time we have seen him, we make sure that at least we have encouraged him. There is still hope.
Huyu kijana kuna mama alimleta hapa akamdampu hapa na akaenda, na sikuwa na namna kwa sababu alimdampu alafu akahepa, na sikuwa na nia yoyote ya vile alikuwa anafanya. Lakini wakati alimdampu nikasema mimi nitamchukua tu kama mwanangu, na nikasema nitakaa na yeye mpaka nione vile tu Mungu anataka juu ya maisha yake.
Apart from medication, the mentally ill persons receive therapy, the aroma therapy.
He has nobody to look for. He can't turn to mother. The mother died. The father died. The brother died. He only have one sister. And the sister is far from here. Yeah, and he's not well up, also psychologically. Yeah.
About this group, we felt like there are so many mentally ill patients around here. Some are because of the drugs, some are maybe from homes, right? And so many things that give them depression.
Timothy Mbogwa, also known as Muthiomori, has won many hearts within Wangige. Dr. Cosmas' contribution too is changing lives. The team is working wholeheartedly to bring a smile to the despairing in the society. Reporting for Ebru TV, I'm Kaindo Stefano.
Well, thank you, Kaindo Stefano, for that. Let's have a quick look now at the world of business. The United States government's economic stimulus is ballooning into $1 trillion territory, the largest rescue from coronavirus in modern American history. And today, South Korea announced a stimulus package of $11.7 trillion, an equivalent to $13.7 billion simple dollars, to cushion the impact of the largest outbreak of coronavirus outside China as efforts to contain the disease worsen supply disruptions.
Mr. Kenyatta made the Prayer Day declaration on Tuesday. The same day, the Minister for Health announced that Kenya now has 4 cases of COVID-19. On Saturday, the President said Kenyans will pray to God in their homes, with a small group of religious leaders congregating at the State House, Nairobi. He said that in God, Kenyans had a place to turn to amid COVID-19 virus, which has been declared a global pandemic. President Kenyatta said, and I quote, "But we also turn to God to share our fears, our apprehensions, but also to seek his guidance and ever-present protection." End of quote.
Now, Kenya Airways has suspended its flights on 4 routes in the wake of the coronavirus spread. The national carrier says it has suspended flights to Bangkok, Djibouti, Mogadishu and Khartoum. Flights to Bangkok have been suspended until April 30th, to Djibouti till April 19th, Mogadishu until April 2nd and Khartoum until March 30th. The management also said it will reduce flights to Dubai from 2 to 1 a day. Flights to London have also been cut from 7 to 5. The usual 3 times flights from JKIA to Johannesburg have been slashed to 2. And with that now, we cross over to the world of sports. Now, the state of Kenyan football was thrown into a turmoil after the Sport Dispute Tribunal requested world governing body FIFA to appoint a normalization committee after the term of the current Football Kenya Federation FKF regime elapsed. Today, FKF President Nick Mwendwa has come out disagreeing with the ruling, but he will remain in office until they get the way forward from Zurich.
On Tuesday, Football Kenya Federation FKF were left with an egg on their face after, for the second time in 4 months, the Sports Dispute Tribunal annulled the FKF county polls that took place last Saturday and called off the national polls that were earmarked for next weekend. Now today, the Football Kenya Federation President Nick Mwendwa saying they totally don't agree with the ruling.
Then it seems that at some point in the ruling, and this is where we differ with the tribunal, they didn't agree. They say they agreed the code is good, the board is good, but then they turn to the code and say, but inside the code, there's a clause which is not good. Then they should have just said, the code is not good. Because then that's a problem. So they say that the eligibility criteria we put in for elections was not good. And for that reason, then they would say the elections are not proper, were not proper.
In Tuesday's ruling, SDT Chairman John Ohaga took issue with the FKF Electoral Code that set the ground rules for the electoral process, starting with the nomination requirement and the procedure.
The same court asked us to do public participation of this document across the country, a very expensive exercise, for 1 month, and we did it. And they agree in the ruling that the participation was good. And then they turn around and say, even though the people participated, one clause in that document, while the document is good, is not okay. That's one. Two, before we share this document was approved by our National Electoral Committee, was approved by FIFA, and said it meets the threshold, including the eligibility.
Mwendwa says they will not change the ruling by SDT and are not keen to hold a third election in a row after the previous 2 have been cancelled.
We got an election cancelled last year and said, fine, we're not even going to appeal. We're going to go back, we're going to do what they've said, and we did it. When you find that I did 95% correct, what is the right thing to do? You might advise that in future I change, but I think it is wrong for you to cancel an entire election for the second time for such a reason. FKF and myself do not agree with that decision.
The FKF national elections were scheduled for March 27th, when Mwendwa, the only candidate cleared to contest for the presidency.
These fellows who are going to court, I can tell you, none of them, maybe except Sam Nyamweya, wanted to run for president. And if they truly wanted to run, our view has been they should have come. And then, if they are denied a fair opportunity, then they can go and complain. They never came. So how do we even know that you're a candidate?
According to Mwendwa, they have shared the outcome with FIFA and will remain in office until they get the way forward from Zurich. The federation had gone to SDT last month to have FKF hold election without following the stringent requirements set by Sports Registrar Rose Wasike. Davis Mberia, Ebru Sports.
Well, thank you very much, Davis Mberia, for that. That's how we wrap it up right here on Ebru Prime Time News on this 18th day of March 2020. Listen, 40920 is our SMS line. You can always talk to us. Tell us what you think about this bulletin and our general programming. And many thanks for watching this. That's on behalf of everyone who has made this a success, including my able director, Alice, at the background. My name is Eric Munene. Our sign language interpreter at the bottom end of your screen is Joyce Warimu. Keep safe.